So in this Rethinking Anatomy video, we're going to be looking at the Popliteus muscle. And it's not the most popular muscle that people come across a lot of the time. And if you're unfamiliar with it, there's a very, very good reason as to why knowing about this muscle is going to help you a lot with your client's training or anybody who presents with you with knee pain. So first, anatomically, we'll look at the attachment sites. So this is the lateral aspect of the foot, lateral aspect of the tibia. So in this lateral epicondyle, the popliteus moves in a fan-like shape into the upper posterior aspect of the medial tibia. So basically from here to here. So we're going from this point to this point here. Now, if I was to contract that muscle, so we were going to move this point here closer to the origin, we would see this occur. So we would see this rotation, which is relative internal rotation of the tibia in relation to the femur. So in other words, we have an internal rotation process. However, something that's really important to consider is that this is only when the foot isn't in contact with the ground. So when we're swinging, so during the swing phase of gait, the popliteus is working as an internal rotator to basically position the tibia in a more theoretical neutral position, preparing it for heel strike. So it's a swing phase internal rotator of the tibia. So if you notice somebody when they're walking and they have a more externally rotated foot, this can be an indication that the popliteus muscle isn't functioning properly. However, when the foot is in contact with the floor, so now we have this is compressed and we're going to switch those around, is that if the foot is internally rotating, so the tibia is internally rotating, that's actually external rotation of the femur. So the femur is externally rotating. So if we want to train the popliteus when we have the foot in contact with the ground, we would need to be doing something where we have external rotation going on at the femur relative to the foot. And that can be actually replicated in exercises that we do in the gym. Now, the reason why this is so important is because the popliteus is essentially the lock and key muscle to the knee. The knee needs an element of rotation, so we need internal and external rotation to occur like this to enable sagittal plane flexion extension to occur much more effectively. If the popliteus is inhibited, so basically we're not getting that rotation, it can impact the position of the knee and lead to irritation in any of the meniscus bursa or the tendons that surround this area. So in other words, a popliteus which doesn't function properly can contribute to knee pain. Therefore, if we know how to target it through exercises and specific movement patterns, will help that function. A really simple way of seeing if it doesn't function is looking if people have hyperextended knees, whether they have pain on palpation around the area, or whether when they're walking there's virtually little movement through the knee joint in any types of planes of motion.
So if we were training the popliteus as an internal rotator during the swing phase, essentially what we'd want is zero movement in the femur, and we want this motion here, so basically where the tibia is able to internally rotate. Now that movement as an isolatory movement, something you do, is probably not the most practical or something that you want to do in a personal training session, and the carryover is going to be minimal with a lot of people. So if we look at the other way, is what does it do during stance, so what does it do when we're loading the leg in terms of that external rotation the femur. This is something that is actually really effective just for improving knee mechanics. Now, with all exercises, whether it's an absolutely 100% precise popliteus exercise, it can be debated, but what we are looking at is, are we improving the dynamics of how the knee rotates and specific phases of walking and running. So what you'd want to do for this one is that, Will, if you could stand here for me, please. Facing that way, please, towards the box. So what we need is this if you have a slight bend in this right knee, if we wanted this femur to be able to externally rotate, we would need something that's going to drive external rotation in that position. So what we would do is that if Will does starts off doing a step up, just bringing your left foot, or actually your left foot onto there for me, please. That's it, and back. Now, if you bring that back, just do that motion, just continually going like that for us, please. That's good. So we're thinking about this process, about how we can get this to really drive some rotation in the knee. And what we can do is that if we get the torso basically to rotate and change the direction of which he sends his left foot, we're going to really improve this external rotation position around the knee. So in other words, if I just move this to the side here like that, and what I want you to do is now step up, but place your left foot into the middle of the box like this. Good. So now we've got some external rotation going on, but are we actually going to get it, or actually driving the muscles to work on this right hand side? So what we're going to do is I'm going to place a wedge under Will's heel and say keep your weight through your heel here, and now don't raise the don't take this foot off. Have a slight bend in your knee, and then I want you to do the exact same motion. Good. So this is really good that we can see at the back of the knee here, because what we can see is that if he starts an internal rotation here with the femur, so basically we've got the tibia and femoral internal rotation, is that as Will steps up, and then I want you to go to there now, so really go across your body, is that we've got external rotation going through here. So everything that's working on the outside, these hamstrings, are going to really drive that. So if you come back for us, please. And now we're going to add just a little bit more knee bend and a little bit more rotation and drive pushing off this heel. So I want you to do a tiny little squat, so squat down like that, and I want you to push through your heel and now go into that position there like that. Good. And come back down there and extend through and back like so. So what we're doing here is, as this is happening, is that because we're now getting the heel driver, so we're driving through the heel, rotating through the torso, getting external rotation occurring through there, and it's really going to help the dynamics of the knee during this stance phase, because this is a really important process that we need for resupination of the foot, for the whole chain when we're driving off the ground. Another way we could do this is actually to strengthen the intrinsic foot. So one way we can do that is if you take this away for us, please, mate, put your toe on there like that, and this is a variation of what's called a big toe plank. So all you do is keep your heel up like that, so your toes just floating through there, push the toe down there, bring this knee back slightly like this, heel up, and this is essentially just an isometric for the muscles in the feet. And the more Will puts the centre of pressure through that side, you'll start to feel muscles in the intrinsic foot working. So everything here working like that. That's going to fire up muscles in the foot, which we really want, and then we can take them back into the exercise. So you bring that heel back like this, and then you're going to go slight bend your knee down into your squat and do that rotation, push through that side like that. Good. And down and back. So again, if we're looking at this muscle, is very important for the function of the knee, and doing these two drills are going to help it with its external rotation process, which is what happens when we have our weight over that side of the body, which again is going to help with knee function in general.